Hello, everybody. Welcome, and I hope that everybody is safe and healthy. Thank you. I'm going to thank you in advance right now. This is obviously new territory for all of us, and ask for a little bit of grace and patience. We might have a few glitches in the video, but I think we're going to get through this. Thank you for your dedication to UofL and to the President's Council, to Neely and her team. Obviously, it's tough times right now, tough times, but we're going to get through it. We're going to get through it. I know you didn't log on here today to listen to me ramble, so Neely, let's get going. I'll turn it over to you if that's okay, you and your team, and we'll get going with your report. Does that sound good?
That sounds great.
Thank you.
Thank you so much, Charlie, and I appreciate very much everybody joining us this way. As Charlie said, it's new, and we're all trying to get the hang of it. And I appreciate the feedback and questions that many of you sent ahead of time. And as an FYI, after the live stream is done, we will be posting the presentation. And so if you have any other questions, please keep track of those and email them to Charlie, and he and I will get back to you with answers. That sound okay, Charlie?
It does, yes. Thanks.
All right. So I am going to go ahead and get started. People ask me how things are going, and I have to say that it's tough, it's challenging, it's unknown, but I could not ask for a better group of teammates. I am so impressed with the dedication and the hard work and the heart that this particular Cardinal family is showing. So my sincere gratitude to every single one of them. What we thought we would do is quickly walk you through what we've been doing and give you an overview of different areas that report up to me. We may not be able to go through every single one in great detail, but we will certainly talk about what's happening on the academic side, what's happening on the athletic side, what's happening on healthcare and our external affairs. You may have the most questions for Tom Miller, the CEO of our UofL Health. So we'll make sure that he has some time to cover the issues that you've brought up. At this point, I would like Jake to pull up our screen. Jake, can you do that? Wonderful. So, President's Council, thank you for this time. And I'd like to give you, here's a quick overview of our agenda. I'm going to kick us off, walk us through the academics piece quickly. We'll have Dan Durbin joining us for a quick overview of finances, and you'll hear from Brad and finally from Tom Miller. So, next, academics. When I think about the actions we have taken, Beth Bain and her team have worked tirelessly on this, all of the deans, all of the vice provosts, and so far, the decisions we've taken, some of them you already know, that we decided fairly early on that all of our spring semester classes would be online. We certainly were a leader among the higher educational institutions, I would say, in terms of being quick to make these decisions. We've also decided that for the summer term, we'll be online only. Hopefully something that really helps our students is that because we've switched to online only, the tuition for online classes will be the same as face-to-face. So that should not make a difference for them. For the spring semester, we offered all of our students the pass-fail option. So they could opt in to take the classes pass-fail if they wanted to. I won't walk you through every single thing because a lot of this is detail that you've read in the paper or you've seen. The big takeaway I'd like you to have is for our students, to the extent possible, we've tried to be accommodating of them. You've heard me say a couple of unique things about University of Louisville. One, how we are an elite research university. The numbers across the US and Canada is about 130 now. So we're one of those research universities. But you also know that among research universities, we have a unique problem and a unique opportunity. Almost, actually about 40% of our students are Pell eligible and another 20% are barely above. And that's unusual For typical research universities, it's a fraction of that percentage that are Pell Grant students. Why do I bring that up? I bring that up because we recognize that for many students, we are their home. We are the safest place they can be. So we've made sure that for those students who do have to stay on campus, that we are providing housing and dining options. It's a takeaway, so nobody can sit down and eat in order to promote social distancing, which we are. But just a reminder that we have an incredible opportunity at the University of Louisville to impact a lot of lives. Things that are next steps and that we are thinking about, worrying about, is what do we do with recruitment? What do we do for the fall and for the summer? And how do we make sure that the students who are currently enrolled here, they are facing the same challenges, their parents are facing the same challenges. How do we make sure that they stay in school and graduate? Because we do know that the best thing for them now is to finish out their college education and not have a gap in that. So those are things that we are worried about and continue to work on. The students have been incredibly impressive. We'll talk more about them in a minute, but I'm so impressed by the resiliency that these young people are demonstrating. Big kudos on the academic front to our faculty and staff. When we decided that we needed to take all courses online in accordance with what the governor was talking about and healthcare experts, including our own infectious diseases experts. Within 4 days, every professor had to take their courses online. Now, many of them had taught online and remote before, but a pretty significant portion never did. And so Gail Rhodes and her Delphi Center, that's our Center for Teaching and Learning, really did incredible work in prepping all of our faculty. Now, what's the difference for the summer semester? For the summer semester, we'll be able to be much more intentional and coach faculty on how to think through their course, the pedagogy for an online delivery module. Candidly, for this semester, it was do your best. We need to get the course online. I'm very, very pleased and thankful to all of the faculty and staff. Second aspect we were concerned about is what happens to faculty. Many faculty are going up for tenure. And as you know, going up for tenure, it's an up or out process. And we wanted to make sure, just as we were being compassionate to our students by offering them a pass-fail policy, that this year, this semester, if faculty needed extra time in order to go up for tenure, that we would make that option available to them. And again, on many of these, I'm pleased to say that we are following best practice and others are beginning to follow in line. Would you go to the next slide, please? I want to tell you a little bit about students and student life. Michael Martis as Dean of Students and the entire team. I've already mentioned a little bit about how some students are staying here and how we're offering grab-and-go food for them. The biggest item, I would say, for our students is commencement. Very regretfully, they'll graduate on time, but the big celebration for commencement, we'll have to wait. We'll have to wait until December. We did not go for, let's postpone it to July or August, because there's so much uncertainty about where things will be. And for families, the big reason we did that is for commencement, I know every one of you on the President's Council can relate to this. That's a time when, you know, grandparents, uncles, aunts, families all want to come and celebrate. And many of them will be in the highest risk category, the vulnerable populations. So our students have been very understanding. We've been doing a survey to try to find out how they would like a virtual celebration. Now, many schools, individual schools are thinking of what kinds of graduation ceremonies they may have. That's something that's exciting, and we'll make sure it's not a, we won't combine them with everybody. We'll make sure that this particular class of 2020 gets their due notice and recognition, but it'll be in December 2020. A couple of next steps and things we are thinking about are what happens with international travel. We've had to cancel study abroad and travel for this semester, but we're starting to think about what happens in the fall and where we'll be heading. A big thing is emergency loans to students. Many of them find themselves in very difficult situations. And so we do have a student emergency fund, as many of you know, and we had 154 students apply and about 80 awards were granted. And some of them are still being evaluated because it may be for rent payment that's not yet due. Of these, 66% of the students who applied were Pell eligible. That should not be a big surprise. 32% of them were first generation, and about 40% of them would be a racial minority. So this is a group of students that we've talked about before. When you have neither financial capital because you're low income and you don't have social capital, you don't have people who've already gone to college or are well positioned to help you navigate the system. These are the students that are the most at risk, and that's the group we're paying most attention to. And again, this is true of every university, but we are trying. I do know that our senior leadership team, every single one of them has contributed in some fashion to this need. I'm also taking a look at some questions that you submitted, by the way. So if I'm taking a minute, I'm just trying to make sure that we are going through this. One question was, if students wanted to withdraw from online courses, what are we doing? Because they wanted to be in an in-person class. This may be surprising to you, but we told them, yes, you can withdraw, but you are not to withdraw now. Give it a chance, because our faculty are truly going above and beyond in working with students. So we thought it's in their best interest to try to stay on schedule and graduate on time. So they have that option, but we are encouraging them not to withdraw yet, because if they withdrew now, it's past the time. Even if they had withdrawn 2 weeks ago, they wouldn't get any money back. So this way, it's not a financial issue for them. So let them try and see what online learning is like, because even in the world of work, they will have to learn how to navigate this. So that's why we decided that. Would you go to the next slide? One concern that we have had through all of this is the mental health of our students. This, as you can imagine, social isolation can be difficult. And people who already have challenges at home, we need to make sure that we help them to stay on a routine, prioritize their health care. And so we've had a lot of resources. We're providing telehealth. We're trying to encourage students, even counseling is on the phone, online, trying to make sure that students and faculty and staff, for that matter, stay connected. If you go to our website, I won't pull it up now, I think you'll be impressed with the resources that we have there. And different groups are really making an effort. Dr. Faye Jones, who heads up our diversity and equity efforts on campus, her whole team is also making sure to reach out to students and make sure that they're taking care of themselves the best they can. Would you go to the next slide for me? Employees, you've always heard me say great place to learn, requires a great place to work, requires a great place to invest. Our faculty and staff are unbelievable. I've been at many universities, worked with many teams. I would say the team we have here is truly second to none. I have been most impressed. Right away, as you know, we went to an emergency remote work policy per the recommendation. So right now, as many people as possibly can work remotely are doing that. We do have some individuals who have to be on campus, and these are heroes. We talk about our healthcare heroes, but I don't want us to forget whether it's someone in physical plant or custodians, our HR team, our IT team. There are a lot of people who have gone above and beyond, and those that have to be on campus, whether it's our police or housing and dining, we are very much working with them to promote social distancing. So if we have a custodial team, making sure that we don't have several of them in one building, as one example. We've created a number of resources for our employees, and supervisors have been asked to make special efforts to check in and make sure that their teams are doing well. We're trying our best with a lot of communication to campus, so we don't send you all of those, but if you go to our website, they're actually documented there as well. They hear from me, they'll hear from Beth, they'll hear from their supervisors, so we're really trying to keep open communication going with them. With regard to our employees, in terms of next steps, we have to see. I'm sure many of you have questions about the CARES Act and how it'll impact higher education. We're all waiting to see. We do know that there are carve-outs for higher ed, but exactly what form it'll take, what will we get, how will we use it, remains to be seen. We are making sure all employees and their dependents who are on a UofL health plan, their co-pays, co-insurance, deductibles, all waived for diagnostic testing related to COVID-19, and also any in-network visits associated with that. And because we are encouraging people to use online, we have waived the membership cost, the share for telehealth through June 30th. There are a number of community resources, and we are actually happy that we have the food pantry, the Cardinal Cupboard, so that both students and employees as needed can take advantage of that. Would you go to the next slide, Jake? On research, once again, there may be other material we send you, or if you go to the website, you will see. I am so incredibly proud of the role that the University of Louisville is playing in terms of our research. We have suspended our non-essential research activity. Now, no researcher likes to hear that their research is not essential. All we mean is if something is not time critical, we have closed down those and encourage people to limit the spread of COVID. Our EVP for research, new EVP for research, Kevin Gardner, we'll have him come and present to all of you soon, really has hit the ground running. He's done a great job. In terms of testing, I want you to know that we, through the Center for Predictive Medicine, and we also have a Center of Excellence for Research in Infectious Disease, we actually have capacity for doing up to 1,000 tests a day. And most of them we can turn around within a day. The challenge has been the swabs, trying to get enough swabs and the test kits. You should be proud that we are the place that's provided testing to 12 area hospitals. Because of our research prowess, it's not just us, but not just UofL Hospital, but we've been doing the testing for 12 different area hospitals. And we are glad to do that. A couple of other things I'd like you to know is the team of infectious diseases specialists we have. If you recall, Dr. Julio Ramirez and his team were recognized by Pfizer with the North American Center of Excellence for Infectious Diseases. I think I mentioned it to you all. It was about in year one, eligible for up to $12 million in funding. So having that group and having them tell us this is important, you need to shut down quickly, allowed us to be at the forefront of many higher institutions of higher education. They have been at work tirelessly. And Dr. Ken Palmer and his team with the Center for Predictive Medicine really have been extraordinary. We talk about a Research One university means you have areas of excellence across the board. So our SPEED school, the Advanced Manufacturing Lab, has come through in a big way. They are doing 3D printing of masks and of swabs, and obviously there's a lot to do. And they've also figured out how to decontaminate our N95 masks, which is also very, very critical. Finally, a couple of other things on research. Just last week, our different teams submitted 6 proposals that total to about $20 million, all focused on surveillance or monitoring of coronavirus. If you've been following the news, as I know you have, you will see that a big part of the testing is trying to understand how the virus spreads through the community in healthcare workers, their families, and beyond, because that's going to be very key to control of any epidemic or pandemic. So our people are at the forefront of that, and we will see. Something else that I shouldn't say a whole lot more than this, we'll keep you posted, is that we do have some established tests now by antibodies in the blood serum, and they're offered to the local community to partner with doctors who decide to treat really critically ill patients with that convalescent serum. So we'll wait. We have some other good news, but let it all go through and we will announce to you. But the big news is that our research function is very critically engaged. It's our doctors and nurses, from the bench side to the bedside. We've got it all covered. The researchers, as well as translating it into care for our patients. Next, on athletics, this has been another area. If I told you, I think that the way I divide up my day or think about all the things under my purview, it's the academic side, it's the research side, it's the athletics, it's healthcare, and then external affairs, working with the mayor, the governor, the federal level, etc. So those are the ways in which I divide up my time, if you will. In terms of our athletics association, we've canceled all NCAA and ACC winter and spring practices and closed the majority of facilities. We're working very closely. They have all been wonderful. Vince and all of the coaches to do PSAs, to encourage people to stay home. Our student athletes are reading to students who are staying home in elementary school. We're really trying to model that we are part of the community. And again, Vince and the team are really doing an incredible job. Budget implications. This is a big deal. We really have to figure out what happens. NCAA, as you know, is providing an extra year of eligibility. Each university is trying to look at it and say, what does that mean? What are the dollars involved? How do we react to this? And so remains to be seen. Right now, I can tell you that there's concern about any athletes coming back on campus anytime, even in June. So these are things we'll have to look at in terms of when are they allowed back to have any types of practices before fall football schedule. No new news to give today, except that it's something we're all monitoring and coordinating. So I coordinate with the presidents of the ACC conference as well as the NCAA. Let's go to the next slide. Let me bring up Dan Durbin now to talk about our financial health. Dan was just presenting to another group, and if he's not back on here yet, then we'll go to the next topic and come back. Can we check if Dan is on?
Dan is still with the other group at the moment, but if we want to move to the next slide, we can.
We'll do that. Everybody, thank you for understanding. We are living our lives by conference call. So it's one after the other after the other. And so we're dividing and conquering. I've mentioned a lot of people, in addition to the finance, when that comes up, please be aware that Mary Elizabeth Miles, who's the vice president of our human resources function, has done an amazing job in helping us figure out what to do. Our IT, facilities. I hate mentioning one person because I worry I'll forget someone else, but really everybody has done an amazing job. And do we have Brad on the line?
I am here. Can everybody hear me?
Great. Yes, please.
Okay. Hello, everybody. Thank you for allowing me to share some news about how we've been approaching this new situation relative to advancement. First thing I would start with, not on the slide, is I spent some time last week, and I know I missed a few of you, but I tried to reach out personally to every single President's Council member and had good conversations or good emails or both. Heard back from a number of you, some of you saying, you know, I think one of my favorite responses was, you know what, I really appreciate you reaching out. I think I've been sitting on the sidelines enough. Let's have a conversation about how I might be able to start giving again. So I really liked that conversation. One note about what you see on the bullet points here on the slide is this is going back to March 16th when all of this really kicked off, just to give you a time frame and some scope. So as you might guess, we've had to pivot the bulk of our activities relative to COVID and surrounding our priorities around student emergency funds and staff emergency funds and research and things through the healthcare system. So we've really made that pivot. And I'd like to thank and acknowledge my team in the background, creating new websites and creating new accounts and creating new processes and things we've had to do to work from home and do this sort of thing. One of the bullet points I'd like to point out there, it's the third one down on the left, is back referencing a date of 12/31. The foundation board voted to infuse some additional dollars, $5.3 million, into underwater scholarship funds, which is great news for folks who have had scholarship funds underwater for a while now. And so if you haven't yet, you will be hearing from your development professional just to give you a little bit more detail about those. But we're really pleased that those funds will start producing those scholarships again. So really pleased the foundation board took that action and those funds were moved into the respective accounts. Relative to a giving overview, I won't read the numbers there. But one thing I will point out, you can see the percentages, and our focus, as I mentioned, has really been for the students, for research and testing, and then I think we've all become familiar with the term PPE now, personal protective equipment. We've had folks support the work being done in the SPEED Advanced Manufacturing Lab who are turning out PPE, and so a lot of the gifts, that 40%, has gone to help support the work being done in that lab and through the Con Center. Right now we are 100% certain that we have tracked of about $18,000 gifts in kind. What we know is that I'm working with the hospital, and that number will increase significantly. They are tracking everything that's being dropped off, whether it's meals or masks or flowers or anything. And so we know that number is well below the actual, but that's what we have right now. And then when all of this clears up a little bit, we'll go back and work on tracking and counting all the pure gifts in kind. I will mention we have earlier just this week received a verbal commitment for another $250,000, and we're pretty pleased about that. And then we have several conversations going out or with folks in the 5 and 6 figure range. So you can see that $164,000 of total gifts noted there. That number will jump significantly, we think, in the next week or so. And the way that breaks down, one item of that was almost $30,000 has come online through email, text to give programs, all those sorts of things. So we're going to meet donors where they are. And what I'm pleased to say is a strong percentage of that, of those folks who have responded online, are first-time donors. These may be newer grads and they're making a $10 gift, or just folks who said, you know what, this is time, I need to do something special for U of L, and a lot of those folks are doing that online. Relative to next steps, as you see, we continue with the focus there. Around the Alumni Association, we're continuing to try and think of creative ways to keep our alumni engaged. So we're doing virtual happy hours, and some folks are putting together game watches of previous national championships and big games. And so the Alumni Association is working to be creative to try and continue to bring people together. And then we have made the decision within advancement that each quarter we get a small percentage of revenue from our merchandise story on Fanatics, and we have decided to forego that percentage for this quarter to my advancement budget and give that to the Student Emergency Fund. So we'll be making that transfer of funds. Last couple of things I would mention. Some of you do gifts through your IRA required minimum distribution. There's a new nuance with that through the CARES Act. So if you have questions and that's how you have given your gifts in the past, please reach out to either myself or the development professional with whom you work, and we can tell you about how that works and what the changes are relative to that new legislation for the required minimum distribution. The last thing I would mention, and it's not on the slide, and I had this conversation with a few of you on the phone, is it's become clear that a lot of folks are connected to foundations or family foundations or corporations around town. If you have an in for us and can make a referral of some, a smaller family foundation or something that may not necessarily be on our radar yet, we would love the referrals. We will follow up on every single one of those that you provide for us. And that's all I have.
Thank you, Brad. Before Dan Durbin is back, and before I bring him on, I want to say that our big needs right now on campus, I know it's a tough time and there are a lot of people who need help. Students, staff, and research. Those are the areas I am concerned about. Staff as well. We have a lot of people who work a couple different jobs and what will happen to them. And we are very, very mindful, but those are our areas of concern. We have programs, and if you have questions about any of that, including for research, even specifically to COVID-19, we'd very much appreciate that. Dan, let us go back to you and maybe have you walk us through.
Okay. Good afternoon, everyone. I wanted to spend just a few moments telling you about some of the things that we've been doing to make sure that our financial house is in order, and some of the things that we will be doing over the next few weeks and next few months as this whole situation evolves. And from a perspective of the past, we about 4 weeks ago, as the significance of this of COVID-19 started to emerge, we recognized that there could be some pretty serious financial implications. So we implemented a set of measures on our part to across the university to help to preserve our cash position, knowing that cash would have to get us through this. The first thing we did was we implemented a savings incentive plan that was designed to really suppress spending but give units some incentive to be able to do that, so they could retain a greater percentage of those savings to help meet future obligations and challenges that they may have because of this situation. So we implemented that savings plan, and within that savings plan, we also provided instructions to eliminate non-essential expenses and also curtail both travel and hiring. Again, with the purpose of preserving our cash position and trying to prepare us to be in better shape for the future, given the fact that we didn't know what the future was. We wanted to make sure that we had options to be able to deal with to make sure that we remained financially strong and we could weather this storm. So from a next step standpoint, in addition to those efforts that I mentioned a few moments ago, we started to look ahead, and by performing what I'll call a risk assessment, we took inventory of everything that we felt could go wrong and what would be the dollar value if it went wrong. And we looked at it at 3 points in time. We're looking 3 points in time to the end of this fiscal year, through the end of December, and to the end of spring. God forbid that it should end. It should extend to that time period. And we're at the phase now we're after identifying those risks. We've quantified quite a bit of the dollar value of those risks, and now we're starting to go back and determine steps and implement steps to mitigate those risks. And for example, one of the greatest risks that we were looking at for summer was the fact that we would not have in-person or face-to-face classes during the summer. But those in-person classes in the past had represented about 60% of our revenue stream for summer courses, about $14 million. We didn't want to lose $14 million, couldn't afford to lose $14 million. That would be disruptive from a budgetary standpoint, and not offering those classes to students would be disruptive from an academic standpoint, because some of them were counting on those courses to graduate in December or next May. So we set about a path to, in very short order, to convert all of the in-person classes to online classes. And we actually converted over 550 traditional in-person classes to online classes to help preserve that revenue stream. So that's one example of we saw the risk, we identified the magnitude of the risk, then let's figure out how we mitigate the risk. It's constantly changing. Costs come up, revenue losses materialize, and again, it's a matter of we're monitoring these on a it's even more than a daily basis. I mean, I have this risk model open almost every hour of every day with teams of people engaged. And speaking of engagement, the other thing that we've done is we're actively engaging by meeting virtually, but meeting with each of our deans to try to better predict this year, provide some strategies in terms of how they can end this year in better shape, and have dollars left in the bank to be able to meet the challenges for next year. So we're already working on the budget for next year, but we just expanded the scope to include the rest of this year for that as well. So we're trying to manage this thing from not only a short-term but also a long-term basis. And one of the bright spots that I know Brad mentioned it a few moments ago, but I'm sure others have as well, and that's the CARES Act legislation. It's $31 billion of that CARE Act was allocated to the Department of Ed. About 14 million of that will specifically go to higher education, and at this point, the university is identified to receive about 12 million of that, and it's 12 million in two streams, divided 50-50. Half of that goes to emergency aid for students, and the other half, roughly $6 million, goes to the institution to help offset some of those disruptions that I mentioned a few moments ago. So the good news is that the Act does provide some funding. It does provide some flexibility, and that we can defer some tax payments, for example, to future years. It does provide welcome relief. Frankly, I don't think it will be enough relief. We're still going, well, I know it's not going to be enough relief for us and everyone else, but it's a matter of it does provide help. And we are looking forward to Department of Ed guidelines, more definitive guidelines to help us deploy those dollars in a meaningful way, not only for us, but also for the students. And in closing, I would say that this is probably one of the most disruptive and financially serious situations that I've seen. But our interaction with the campus, both the involvement and the engagement between the campus deans, the students, the faculty, the administration, has really it's been amazing to watch how quickly we can change things. For example, we brought all the spring courses online. We subsequently brought the summer courses online, and we're actively working with all those groups as we start to have to pull levers to be able to meet these challenges to do so. So, it's again, it's a work in process, but I thought the council would be interested in knowing kind of what we've done, what our thinking is in terms of the future, and how we're trying to influence the future through some pretty intense planning efforts and engaging planning efforts.
No question at all. Dan Durbin, I've always joked, I've always thought I was the hardest working person I knew. I think I have competition now with both of the next gentlemen coming up, both Dan and Tom. It's actually everybody. Could not ask for a better team. And I forgot to mention one person that definitely deserves special recognition, and that's my chief of staff. Michael Wade Smith really helped keep all of us on track. We would have multiple meetings a day. We now, for the very large group, that's me, all of my direct reports, and pretty much all of their direct reports. So we would try to meet a couple times a week online, and that has been very helpful, I think. So with that, I'd like to transition to Tom Miller. We are saving the best for last so that he can have some time to walk you through where we are. Two things before Tom gets started. I'd like to remind you all that we now have a phenomenal UofL Health Board. That would be the members of the board. I chair the board, and we have Tony Ganzel as the Dean of the School of Medicine and Vice President for Academic Medical Affairs. Kelly McMasters, who's the chair of our Department of Surgery. Diane Medley as a member of the UofL Board of Trustees. She's also the chair of our Finance Committee. So her being on this is very helpful to keep the board updated. And Dr. Fred Williams, who used to be on our board as a physician representative from the university side. I am so excited to share with you the members from the community who've signed up to help us guide this institution. Pat Malloy, Ben Breyer of Kindred, Heidi Margulis, retired from Humana, Junior Bridgman, Bill Ballard, and Rick Riney. So we're very pleased with the caliber of the people that we have, and we update them regularly. And with that, Tom, I want to commend you for how well you communicate with a pretty complex organization. Tom Miller, I think, has 5 or 6 phone calls a day like this. And that's important because there's so much happening. And I appreciate your taking the time to join us, Tom.
Thank you, Neely. I put on a mask because if you walk around the hospital, you'll see everybody in a mask. But since I'm in my office, I'll take it off for these purposes. Just a couple questions that I wanted to answer first, because I think the questions that were, how are we doing with the acquisition of Kentucky One, and why did we reduce our amounts that we asked from the state from 50 million to 35 million? Before March 6th, the Kentucky One acquisition was going better than anyone had any thoughts related to it. We were ahead of our financial standpoint. We thought we would lose in this initial budget period about $20 million, and we were about $10 million to the positive. Every interaction that we had with staff at the Kentucky One facilities were positive. We were beginning the investments into those hospitals, and it looked like it was going to be one of the best decisions that the board has ever made, and we still believe that will be the case. And because of that, and Neely felt a responsibility of the state to make sure that we only asked for what we truly needed. What we had determined and why we were being successful financially were 3 reasons. One is we knew the state would consider Jewish Hospital as a teaching hospital, but they were working very diligently with us and included St. Mary and Elizabeth Hospital, Peace Hospital, and Fraser also as teaching hospitals. That allowed us to get some additional payments in from the state through the federal government that increased those numbers by about $20 million. We were also, we expected to receive some money as a result of reductions of corporate overhead. Kentucky One was charging these hospitals $40 million. We were not setting up a structure. We expected to save some money there. And we also expected to save some money in regard to the procurement process as we brought these 2 organizations together. And as a result of that, we felt like we were going to go from a negative standpoint to a positive standpoint. And Neely, out of respect to the request of the governor and others, made a decision that we would only ask for the $35 million, which we have received. And so I would have told you to that date on March 6th, everything was going perfectly. There were no surprises that we had, and everything was going great. March 6th is the first case of coronavirus in Kentucky, and things changed a lot at that point in time. And so what has happened to the organization is the governor has put in place an executive order to ask us to reduce elective procedures and visits within the hospital. As a result of that, we've seen about a 2/3 reduction of surgery in our hospitals and about a 90% reduction in our ambulatory surgery centers. Our physician office visits are down by about 58%. So our volume has gone, and so our revenues are down by about $32 million a month. It's a pretty scary number when you hear, but it's a significant reduction. And the reason the governor did that, and I will tell you, the governor has been ahead of the states in regard to trying to protect the citizens of Kentucky. But he was trying to do two things. One is he was trying to reduce exposure, and he was trying to protect PPE. And those two things he has successfully done. And if you were to look at the prevalence curve in Kentucky, we're one of the lowest states with the lowest curve in regard to any spike that might happen associated with the coronavirus. But the coronavirus has had an effect on us. But I would tell you, all of our staff are doing everything they can do. They're coming to work. They're willing to take care of patients that are in need, and they're not hesitant to do what is right for the community. So I will tell you, we have about 10,000 heroes that are working within the organization. But let me get more specific about the coronavirus, because I know that's what's on your interest list. First of all, let me just give you some numbers so you can understand where we're at today. Kentucky has had just over 1,000. They went over 1,000 cases yesterday, and about 60 deaths. The Louisville area is about 1/3 of both. We've had about 319 positive cases and about 22 deaths. From our hospital standpoint today, we have within the 6 hospitals, we have 30 positive patients that are in-house to our hospitals today, and presumed positive, which are patients who have not tested positive but show signs and symptoms, about another 29. So we have about 59 patients within the hospitals that have a component of symptoms that might appear to be or have tested positive. In our staff standpoint, we haven't had a lot of staff tested positive, but we do have a lot of staff who are isolated. Either they've left the state and are coming back, or are taking care of somebody in their house that is presumed positive. So we have about 58 staff right now who are isolated. As you look at our facilities today, there's a couple things that you might want to understand. One is we have about 1,200 beds available today for patients. We're only running about 700 patients in those 1,200 beds. Generally, we've seen a significant reduction of patients in the hospital as a result of the elective order directives from the governor, and patients who just don't want to go to healthcare today, and they're holding off on their care to a later point in time because they're isolating in place. We have the capabilities under the highest surge component to go from 1,200 beds to about 1,750 beds. That would be using every bed that we have, every recovery area as a hospital bed. And so we have the ability to ramp up about a 50% rate to about 1,759. So I would tell you, we have 1,000 beds today to be able to put patients in if there was a need. But today, from our standpoint, we are not seeing a surge. We're seeing just the opposite. We're seeing a reduction, so more available beds. Our ICUs are running about what they normally run, so there's no increased use of ventilations. We have 44 patients on ventilators. We have 154 ventilators available, so we've got over 100 ventilators available for patients, and we've requested another 90 that we hope to get in. So I would tell you, from a surge capacity, we're well protected. Our primary goals within the organization are about three things. One is protect our staff and protect our doctors. You heard the term PPE. Our goal is to make sure that our staff stays safe. And so we have today, we've been successful in getting from a lot of sources extra protective personal equipment that would give us about 100-day supply on today's usages. If there's a spike, that would go down, but right now we feel like we have adequate personal protective equipment. We've also gone to universal mask protocol, so everyone that's in clinical areas are wearing masks every day in order to protect them and to protect anyone else. And we have received 4 shipments from the state, from the state's strategic supplies, which have helped us out. We've not received anything from the federal government. Everything from the federal government is being rerouted to New York, New Jersey, Connecticut, and California. So we haven't really received anything from the state at this time. That could change. But our number one goal is to make sure we have enough personal protective equipment, which we do today. So we're in good shape. That's across our hospitals. Second thing is to open up testing. And Neely mentioned that about what the university research lab is doing. They're doing a majority of the testing in the entire community, but we don't have enough test kits. And we're trying to open up testing because we believe the numbers are low in Kentucky because we're not doing enough tests. And that's an unfortunate thing. We need to be able to do tests so that if someone tests positive, they can isolate themselves. And even though we're all in self-isolation, if you're positive, you should isolate yourself from your family members. And so we're not doing enough tests. We have opened up a week ago some community-based testing. It takes an order from a primary care doctor or someone to do those tests. We're doing about 50 to 70. We can do up to 100 a day. This is to the corner of Brook and Liberty Street. That's an outside testing or it's a drive-by. And we're testing every patient that comes in the hospital. We've begun testing our own staff, and we're actually finding some of our staff testing positive that show no signs or symptoms, which is what you hear throughout the United States in regard to that. We're also trying to make sure that we're effectively managing the hospital. Again, these elective procedure reductions had a significant impact on our organization. We sent over 700 people from our hospital home to work, and you would think that we couldn't send that many, but those are business office types of functions, medical record types of functions, and other administrative functions. We sent them all home. In about 10 days, we were able to take our physicians who had about 10 of them could do telemedicine. Now we have over 700 doctors who can see patients at home on their computer through telemedicine. And that is a great advantage to be able to take care of patients, because the worst thing in the world is if you're having symptoms, you'll hear the doctor say, don't come in, stay home and isolate yourself. If you're having respiratory distress, come to the ER. But trying to keep the doctors and the staff in the doctor's offices safe. And then Neely mentioned that, we're also restricting access to the hospital in our visitation policies. We have closed down half of our entrances to the hospital. We have staff and security guards at every entrance where we're screening every patient, taking a temperature and asking questions of where they've been. That will change later this week, where we're going to go to a no visitation policy just in order to protect everyone within the organization. And there'll be some exceptions for people who are ladies who are in delivery, they'll be able to have somebody with them, or end of life. But we really are going to have to restrict this the safety associated with it. So our primary goals, again, PPE, testing. Third, preparation for surge. Again, I mentioned that we've got a phase 1, phase 2, phase 3 components of it, of how we would phase up to meet the needs of the community. We're working in coordination with Baptist and Norton so that we can make sure we all understand the needs of the community. You heard that there was going to be a 2,000-bed hospital set up at the fairgrounds. I don't believe that'll be for the Louisville, for the people living in Louisville. I believe we have enough beds and ICUs available for those individuals, but it will be trying to meet the needs outside of the community where there are less resources that are available. But it's available to us. I'm not sure how it's going to be staffed yet. You know, the interesting thing about coronavirus from your standpoint is you just need to understand last year there were about 100 deaths in Kentucky with the flu. And today in Kentucky, they're anticipating about 1,700 deaths in Kentucky as a result of coronavirus. It is significantly more deadly a type of virus than the flu is. And so just a couple other things. The economic development loan that we got from the state, we have received that money as of April 2nd. That was $35 million. And Dan mentioned that there is an act that was put in place called the CARES Act that would allow hospitals to gain access to some resources. It has to be paid back, but resources that we could use if we needed to. But I would tell you, as an organization, our staff are responding extraordinarily well. We do ongoing communications every single day just to make sure we're answering every question anybody has, make them feel confident. And I think they do understand that they have the resources they need to go through this. This has had a tremendous impact. I've been in this industry for 35 years. I've never seen anything like this. We talk about it sometimes when there are hurricanes or when there are tornadoes, but this is going to go on till, I'm guessing, second or third week in June. And so we're going to be isolating in place for a while. The hospitals will still not be able to do elective procedures probably until July 1st. But it's an interesting time. But I would tell you, we're handling it well. We are a key provider in this community. And so all of our hospitals are stepping up. Our priorities, again, are maintaining PPE, access to testing, surge preparation, and then make sure we have the cash just to continue to another day. And we're okay with all of those. So, Neely, I'll stop there and just take any questions.
Thank you so much, Tom. Jake, I would like you to pull up our webpage, if you could, where we have all of the details of what we're doing. So everybody, we will also happy to send you an email with this link. But if you look on here, you'll find the latest information on what the university has done, our updates. You can see all the messages, what's going on, travel guidelines, anything you might need. We definitely rely on you. I've told you many times, you are my counsel. And so I want to make sure that you have the information you need. Again, we appreciate you very much, and I hope you didn't think this was a lot of our patting ourselves on the shoulders. That's not it. I don't have enough opportunities to thank the team for how hard they're working and how much they're putting the good of the institution first. So we'll keep you posted. And I was looking, I think I do have permission. We do have a new serum. Let me look. I do want to be able to tell you. One of the first compounds that we are testing, therapeutics and vaccines that's being tested, the first compound is called AS1411, AS1411. It'll be an antiviral therapeutic. It's shown to be effective, and we hope that it'll be approved and publicized soon. So on research, on teaching, on all of the student care that we need to do, we're doing our very best. I'm so grateful to our faculty and to our staff, and I'm grateful to you, and I'm honored to be your president. With that, I am going to turn it over to Charlie Dollum.
Thank you so much, Neely. And I mean, I think I speak for the entire council when I say your team, you said it earlier, your team's amazing. I mean, you all have taken this aircraft carrier and you all have redirected it at lightning speed. It's really, really impressive. And, you know, you have the support of everybody on the council, and it's difficult times, and this is kind of awkward. I know reporting out like this, but I think it's helpful to get the message in the community. It would be helpful maybe that if y'all could send that slideshow, the slides, Jake, I don't know if we could get that out to the whole council so that people could possibly review that. Dan, Tom, and Brad, thank you all very much for your reports. Brad actually texted me after his report, and somebody on the council texted him and gave him a donation. So I just wanted to let everyone know that Brad's line is open. That the lines are open for donations. So don't let all of this slow that down. And great questions. And like I said, Neely, we wholeheartedly support you. On another note, just real fast, Jake and I got together and we took our new council members from 2019 and we've assigned them to visiting committees. I've asked the chairs of the visiting committees to reach out to those people and explain to them what the visiting committee is all about. So that's underway right now. And I've also asked the chairs to reach out to the deans and ask the deans what, if anything, they might need right now. I realize that's a little bit of a loaded question, but we just wanted to continue to try to get that back on track and move that forward, as awkward as it is right now. And we will continue to engage the council electronically in this way as long as we have to, until we can all get back together in the same room again. But Neely, you all are doing a fabulous job, and we're all here to help you with the students and with your staff and your faculty, and we'll try to keep this whole thing moving forward. I know you need our support more than ever right now. So if anybody's got any questions for me, I'm available by email, by telephone. Obviously, Jake and Brad and everybody and are available too. Guess with that, we probably are about ready to adjourn, because I'm sure that Tom and everybody have a whole lot that they need to go do.
True.
So,
Thank you, Charlie. Thank you, everybody.
Thank you all. God bless.
And everybody stay safe.
Yes.
Thank you. Bye-bye.
Bye. Bye, Neil.